A pleasant morning to each and every one of you. The recent issues in the society that we observe recently has been mostly causes for another social concern until it leads to a chain of social issues that Filipinos experience in their day-to-day lives, such as poor educational attainment, which leads to affecting unemployment rate, family malnutrition, and even mortality rate increase to some extent. As college students of the LSUD, Squad A of CEE 12 has decided to share and properly explain how these social concerns relate to one another and how it all comes from just one major social concern. We, of course, are talking about the Philippines' never ending issue poverty. But first, let us discuss about the different causes of poverty, starting with corruption.
In the Philippines, corruption is a major impediment to good administration. According to a survey of current literature, the Philippines has a significant size and extent of corruption, ranging from minor bribery to grand corruption, patronage, and state control. To combat corruption, significant efforts have been undertaken, including the establishments of legislative and institutional frameworks, as well as initiatives by social society organizations and the media. Corruption does not only affect the growth rate of income, but also affect poverty. Corruption affects poverty by first impacting on economic growth factors. Corruption will lead to lower economic activities, create inefficient by increasing the business, thus hinders income inequality, then leads to poverty and economic. Thus, the alleged corruption in the Philippine Health Insurance Corporation or PhilHealth is an exemplification of systemic corruption in the present day in the Philippines.
Education, as what we know of, is often referred to as the very solution in order to give us an individual access to many opportunities, such as job offers, family resources, and essential skills that an employee needs in order to work efficiently in one certain company. Without these skills, the individual may experience difficulties in finding a job that would provide enough wage or salary to sustain his or her family's needs. Without the proper education that I've mentioned, factors such as economic growth, infant mortality rate, and even sexually transmitted diseases become the effects due to a Filipino individual's lack of proper understanding to avoid these circumstances. It is without question a good thing to consider and value educational attainment because of the solution's capability to alleviate the unwanted impacts of poverty. And according to UNESCO, if a nation manages to provide adults access to complete secondary education, quote unquote, we could cut the global poverty rate by more than half.
It is certainly true that the lack of family planning brings many financial pains to the parents or breadwinners of the family. This begins from insufficient knowledge and access to contraceptions or not attending family planning programs. In most countries, women from poor households are less likely to use family planning services than wealthier women, even when poor women want to delay or avoid pregnancy. According to a poverty reduction research, about one third of women in the poorest fifth of developing country households worldwide have an unmet need for family planning. They did not want to get pregnant, but were not using family planning methods or are met with undesirable circumstances. Women living in poor communities tend to have less access to family planning services, but even those who have access are often reluctant to use these services. They may perceive religious opposition or disapproval on the part of their husbands or other family members, or have unfounded fears of contraceptive side effects. While it is important to educate women about contraceptive methods and the potential for certain side effects to occur, Family planning staff reported that women's fears were best allayed by getting to know other women who had used family planning. The actual or perceived opposition of husbands is an often cited barrier to contraceptive use, but this can sometimes be overcome if spouses are taught to better communicate with each other about family planning issues and by involving husbands in educational outreach about the benefits of family planning and birth spacing. While there are some couples who desire to have a large family, they're endangering themselves and the well being of their children without proper consultation and knowledge. This carelessness results to high child mortality, child's malnutrition, and underdevelopment. The possibility for large families without family planning tend to be exposed to a higher rate for diseases and illnesses, which can further add up to the family's monthly expenses.
Poverty is believed to be the leading cause of overpopulation, a lack of educational resources paired with high death rates, leading to higher birth rates, result in impoverished areas seeing large booms in population. Causes of overpopulation are different for many countries, but are mostly associated with poverty, reduced mortality rates, poor medical access, poor contraceptive use, as well as immigration. With overpopulation comes a decrease in resource and an increase in symptoms of illness and diseases. The world's poorest countries tend to have the largest family sizes and fertility rates when people have no economic security and cannot rely on their government and a social safety net. They often have children to ensure that they will be looked after when they are older. Where child mortality is high, where child mortality is high, there is an even greater impetus to have more children. Those circumstances can lead into a culture which values high family sizes. This understandable human impulse can contribute to a vicious cycle. Poor families with large numbers of dependent children may perceive the need to take children out of education early. They will also often live in deprived communities where access to modern family planning is limited. All these factors combine to keep family sizes high, perpetuating the cycle.
So now we know how these causes become factors that affect poverty. Let's take a look on how it can affect our society through different means, starting with domestic violence.
So, domestic violence. Poverty has been related to higher incidence of domestic abuse, and it can affect any family member regardless of who is the aggressor. The link between domestic violence and poverty, as well as the cycle that many families fall into, is bleak. So, when the cycle of domestic abuse starts in these conditions, many families are thrust into an endless nightmare that appears unlikely to end. The family of an abusive partner who is also destitute frequently sees no way out of the vicious circle, and the financial quagmire in which they find themselves continues to fuel their rage and outbursts. Because of the domestic violence and poverty they have experienced, many women in domestic abuse relationships end up homeless. So, domestic abuse shelters have experienced a significant increase in the number of women and children seeking assistance.
Poverty and poor health are intertwined since poverty increases the chances for poor health. An individual who lives in poor conditions or community suffers more about their health because of the lack of resources to provide life necessities like clean water, food, shelter, access to healthcare facilities, and job opportunities. Poverty increases the risk of malnutrition, diseases, infection, and mental illnesses, including schizophrenia, depression, anxiety, and substance addiction.
Poverty can be a direct or indirect contributor to unemployment. As of May 2021, a SWC survey reveals that 39% of families in NCR consider themselves poor. These rates were higher in outside of the capital. Now, these families can't afford to send their children to school and are forced to take employment early. These jobs are often lowly paid employment and without educational background. their job prospects would be even lower. Although the government have launched educational programs to help those in the low income members of the community, the program itself is limited and many are left out to fend off for themselves. Poverty births to poverty. As the cycle goes, so is also the continuous unemployment rate in the country. Thus, poor becomes more poorer.
The relationship of a mother's level of education to the health and well being of her child is evident in that the probability of dying among infants whose mother is received no formal schooling is 2.5 times higher than that for infants whose mother has had some high school education. Lack of sufficient medical care before and at the time of delivery can increase the risk of complications and infections that can cause death or serious illness for either the mother or the newborn. The survival of a child is closely linked to the provision of primary healthcare services, but poverty, malnutrition, a decline in breastfeeding, maternal education, use of improved water, and inadequacy sanitation and health facilities are all associated with high child mortality.
Okay, so lack of family planning, domestic violence, and increased unemployment rate. Poverty has been a national concern for so long, and it has affected our society and economy in endless and continuous ways. So, Squad CE12A has decided to come up with a solution to end the social concern. So, to us, education would provide all of the answers to end overpopulation, a factor that is related to lack of family planning. And that is because if all of us had a deeper knowledge regarding the benefits of deciding what to do before and after you engage in a relationship with another individual, we would have prevented these two major concerns and not consider it as an issue. So in essence, quality education is what we think would provide the awareness for every Filipino citizen in order for themselves to come up with better solutions and decisions in order to properly mitigate all social concerns discussed in this topic. Based on a study, Filipinos have one of the lowest IQs when compared to other countries. And I am not stating that we are not yet smart enough to understand these situations, but rather, we do need to help others who are less fortunate and at least provide them as much quality education as others, such as the Lasallians. And that is all. Thank you for listening.